There are two types of diabetic patients, type 1 and type 2 most commonly. So type 1 is people who are insulin dependent, and type 2 people, they are mostly those who take medicines first and then they slowly change over to insulin. So diabetic retinopathy affects both the type of diabetes patient, both type 1 and type 2. Type 1 patients, they can wait for up to 5 to 10 years before they come for a checkup, because it takes quite some time for them to develop. But type 2 diabetic patients, usually those who are diagnosed at older age, what happens is when they get diagnosed, it is already delayed. Probably they might have been having diabetes for quite some time, say for 2 or 3 years without getting detected. So when they get diagnosed, the diabetic retinopathy may have already started. So this is the eye as we know it. This is a cut section of the eye. If you see, like this is the cornea, and here is where the lens will be, and this is the retina. The retina is the nervous part of the eye. So it has numerous blood supplies, as you can see. So in diabetic retinopathy, what happens is these blood supplies, they start to close. Just like any other part of the body, this also has blood supply which starts to close. So when it starts to close, earlier on there will be small leakages. This leakage can lead to fluid collection inside the retina, causing reduction in vision. But later on, what happens when there is a massive amount of closure of these blood vessels, the retina starts to become deprived of blood. When it becomes deprived of blood supply, it starts to produce its own blood vessels in areas where the blood vessels have closed down. So these blood vessels are not like your normal blood vessels. They can start bleeding even on mild exertion of pressure, like coughing, sneezing, or even when you're normally sitting and standing. So what happens when it starts to bleed? The patient starts to lose vision. Once the patient goes into high risk, that is, we call it as proliferative diabetic retinopathy, then it becomes very difficult to treat the patient. Even then, if the patient comes at proliferative diabetic retinopathy, if we find it early, before the bleeding stage, it is easier to treat. We can treat without doing any surgery by giving lasers. But if bleeding starts, or if there is any traction, what happens in proliferative diabetic retinopathy? Membrane-like bands starts to form in the retina. These membrane-like bands, apart from the abnormal vessels, will attach to the retina and cause traction. This traction will cause a detachment in the retina. To rectify this is very hard. The success rate comes down as the patient delays it further and further. So it is best to come and have a checkup with an ophthalmologist once in at least 6 months if you have already been diagnosed to have diabetic retinopathy. Even if you don't have diabetic retinopathy, it is better to come and have a checkup once in a year. So we at Trinity have all the facilities to treat diabetic retinopathy, starting from mild stage to even advanced stages like with vitreous hemorrhage and even tractional retinal detachment.